Hi, everyone. Welcome to Beside the Practice podcast. Today, we have a very special guest. She's one of our virtual healthcare assistants working here at Honest Askers. Her name is Sadia. And Sadia, can you please tell us a bit about yourself so people can get to know you?
Hi, Marcella. So I'm a dentist basically based in Pakistan, and I graduated in 2016, and I worked as a dentist for more than 4 years for hands-on clinical experience. Later, I transitioned into a virtual medical assistant, and I have been working for more than 4 years with different practices in US healthcare. And ever since, the journey is going, and I'm loving what I'm doing.
That's amazing. You have a very incredible background, and it's good to hear that you also have dental experience. And what is it that made you want to shift to this virtual healthcare assistant world?
Well, going to the office and to the clinic setting in evening times, mostly during the COVID times, made it very difficult for making commute. And my daughter was very young at that very much time. And when she turned 3, I had to, send her off to the school. And one of my colleagues recommended, why don't you apply for remote jobs? And you can use your clinical knowledge into the virtual assistancy.
Which are the main tasks that you think you can do better thanks to the dental background you already have and patient experience?
Well, I think that my communication with the patients in the clinical setting helped me shape my communication in very patient way, because when I was working with different clinics, I came across different patients with different ages, and there were old age patients that were a bit hard of hearing, and I had to stay patient with them. And being empathetic is the first thing that, as doctors, we need to become, and as humans, it's the most I think special thing that you can do to a patient in pain, a patient who is not getting attention in the emergency settings, and they are, calling you as a virtual medical assistant, and they want someone to hear them out in that very much situation. I believe you need to be empathetic and you need to be patient in order to communicate well with the patients. And this is one advice that I will give from the knowledge that I had and experience in my clinical setting.
And now that you're working with a US based client, do you think it was hard for you to get used to the US healthcare system?
Here in Pakistan, we used to communicate with the clinical based patients through the paper pads. Like, we would be, our name would be written on it, and we would write the prescription on it. And that's how we were working over here. So that was something different in exploring this journey.
And what is it something about living in Pakistan that shaped the way you work as a virtual healthcare assistant?
I believe that in Pakistan, the things are not very much organized in terms of, the appointment scheduling. And if the patient is a no-show, or we need to reschedule them or something like that, it is very taken very lightly. However, in US healthcare system, I see that the patients who are a no-show, or we need to cancel their appointments or something, it's a very systematic thing that a patient is aware of, that if they cancel their appointments, they can't be in time, or they need to reschedule. It is a very a special thing that have seen, that they are organized in their system. And I really appreciate that all the appointments are coming through the calendar, and you know which patient is coming in at what time, and it's just the system that you're using to see what's in front of you.
Now, you already mentioned that you didn't know many tasks that you were going to have, but what is one moment that your client trusted you with something that clicked on you and you said, okay, this person really trusts me and I really appreciate it? And how did you feel?
Marcella, from the beginning of my journey, all my provider was very comfortable putting me into the examination rooms for taking history. And that was the first job that I was basically doing with my patients. And I did not know that he would be very quick enough to put me into the examination room one on one with the patient. And he liked my communication skills, and I was taking their histories, and patients were also comfortable. And I believe that was a achievement for me, because I was never introduced into Jitsi or video communication beforehand. I was doing my patients previously in the clinical setting, but however, I felt like this was a bigger opportunity for me at that very much time, speaking directly to the patients and recording their histories and being comfortable into that position. And also, the doctor appreciated me of my skills of communicating with the patients, and I really admire this opportunity of being able to do it well in terms of his experience as well.
If someone speaks to you right now and they are starting in the virtual healthcare assistant world, what would you say to them?
Well, even when I started here at Honest Taskers, my story was that I was not getting a client in a matter of a month's time. I believe that when I was trying for that, I had to stay patient, and my HR personnel who were connected with me, they were supporting me through that journey. And when I got my client, it was the biggest client that Honest Taskers have, and we are 25, more than 25 virtuals are working with them from Honest Askers. And I think you should always wait for the right opportunity, stay patient. In the meantime, collect something for yourself which is knowledgeable, and please present yourself better in terms of the clinical knowledge that you have and how you're going to help somebody to take away their responsibilities and make the operation streamlined. I believe that my client right now is so appreciative and supportive that I could have not had a better client, and the wait was worth it.
And how did you feel when you found out that you were going to work with the biggest client of Honest Asker?
I am so happy about it. I'm the happiest person.
That's amazing to hear. And I feel very happy for you. Can you walk us through a day in your life so our viewers can know you better also? And yeah, you can mention to us your morning hours in Pakistan when you're working and maybe what you do after. What is life of Sadia every single day?
So my mornings are basically getting up and making breakfast for myself and my daughters, and starting my work early in my morning hours. And then while working through the day, I usually utilize my breaks with my daughters. And when they're coming back from school, we have lunch together. And after that, I continue my work. And after in the evenings, we spend some time along and do the homework. And after the dinner time, we put them to the bed. And this is the usual day, which it looks like for me in a daytime.
And what is one thing you would say to your own self if you could go back in time to the day when you applied to Honest Askers? What would you say to yourself?
I would tell myself to be patient. I would tell myself to wait for the right opportunity and wait for the bigger opportunity, because God always has a plan for everyone, and they put you in the right place. And sometimes the wait is worth it. So this is what I would tell myself.
We're almost done for the podcast today. So, what is something you definitely want to say to our viewers right now?
Wait for the right opportunities, it will come to you.
Thank you so much, Sadia, for joining in the podcast. And thank you for being such an amazing worker at Honest Askers and for helping your client every day.
Thank you for the opportunity.
And if you want to watch more episodes with more amazing VAs, please follow us and we'll see you next time. Thank you.